Welcome back. As I mentioned earlier, we are to cross to Geneva with the World Health Organization Executive Director, Dr. Mike Ryan, Maria, and epidemiologist, Dr. van Kerkhove, are engaging with the public about the novel coronavirus. Let's take you live to that discussion then in Geneva, Switzerland.
For all our viewers to explain how the IHR works and how we can declare a global emergency. I think it's worth as well repeating, as we've been consistent in our recommendations, what all of us can do to stop the spread of this virus. So I think it's worth mentioning as well, what are the measures on individual level that we can also take to support the response?
Yeah, so I think there's a lot that people can do, and I think everyone really needs to understand that they have a role to play. I say this a lot, and I will continue to say this, because we need everyone on the planet to understand that you have a role to play. Whether you are an adult, whether you are a child, regardless of where you live, and whatever type of situation that you're in, you have a role to play. It starts with the basics. It starts with the hand hygiene. Clean your hands where you can, when you can, with soap and water, with whatever means you have, with alcohol-based rub. Physical distancing, so at least a meter apart, and this is, at least 3.5 feet for those of you who don't use the metric system, to practice respiratory etiquette. So that means cough or sneeze into your elbow. It means wearing a mask where appropriate. There are specific settings where we encourage the use of a mask, where you cannot do physical distancing, where the virus is present. It includes staying home if you're unwell, contacting the hotline, contacting your medical provider to ask, what should you do? Should I get a test? It means adhering to the recommendations where you live. So in situations in certain countries, you're asked to wear a mask, you're asked to stay home, you're asked to follow certain rules. Please do so, because that will help break chains of transmission. And it means get involved. Find different creative ways in which you can support the response by helping, checking in on a loved one, checking in on someone. Keep yourself physically distanced, but just check in on people. We have to acknowledge that this not only has an impact on our physical health, but it also has an impact on our mental health. And there are many people that are feeling alone. There are many people that are feeling scared. So there's ways we can be kind to one another and help. And then there's a whole slew of activities that governments need to do and leaders need to do. And I think we've outlined those before. But individuals, really, please be informed, be alert, be aware, find good sources of information.
Thank you very much, Maria. There's a lot of questions coming in from our viewers, and we are very grateful. I'll start with this one from Twitter. Although many are taking precautions like mask wearing and physical distance and also the lockdown measures, still the virus is spreading. Why?
Well, there's lots of reasons I think that the virus is spreading, but the virus likes people. It needs people to pass between. And so where we see transmission occurring, it's between people who are in close contact with one another. In many countries that have had success in bringing the outbreaks under control, they're starting to see some resurgence, they're starting to see some outbreaks. And many of these outbreaks are happening in specific settings. So, for example, we've seen some outbreaks occurring in nightclubs. We've seen some outbreaks occurring related to bars and restaurants, in terms of long-term living facilities. So if the virus has an opportunity to enter those types of situations where you have people coming into contact with one or very close contact with one another, not practicing the hygiene measures and the physical distancing measures and the mask wearing measures that are needed, it will pass between each other. We should not allow this virus to transmit between people, and we have some control over that.
Thank you, Maria. Here's another question coming from a Facebook viewer. Why does some national health agencies recommend for people to be 6 feet apart? We just mentioned WHO recommends at least meter or 3.5 feet.
So we recommend at least 1 meter, which is the 3.5, and it says at least. So the longer, the further, the better, if that could be done. What we've done is we've been working with a number of scientists across the globe on looking at the distance, looking at how far these droplets will come out of an individual's mouth. We know that physical distancing works. And in situations where you can't do physical distancing, we recommend the use of a fabric mask. And just, I should take an opportunity to say that these fabric masks, not all of them are the same. We recommend fabric masks that have at least 3 layers and have this filtration layer in between, an absorbent layer in the beginning and a repelling layer on the outside. So it's a combination of factors that we need. Physical distancing alone doesn't work, masks alone don't work. All of these measures need to be used at once.
Thank you very much, Maria. Mike, we are receiving a lot of questions about hydroxychloroquine and its use in treating COVID-19 patients. What do we know about its effects?
Well, I think the many drugs have been tried in this case, and there's been a lot of repurposing of a number of different therapeutic agents from uses in others. And in fact, we've had hydroxychloroquine as part of our Solidarity trials, as have other big trials around the world. What is clear is that while there have been some observations in smaller studies and observational studies that indicated some positive impact, all of the large studies that have been done so far, the ones that have been controlled, randomized trials, have not demonstrated a positive outcome or an improvement in using hydroxychloroquine in ill patients in terms of improving their outcome. What's still under study is the use of hydroxychloroquine as a prophylactic, as a drug to potentially reduce the chances of you getting sick if you've been exposed or if you've got mild infection. And we're still waiting for final results on that. But I think it is clear that the overwhelming medical evidence is that hydroxychloroquine, based on the science and based on the published evidence, does not show a significant impact in improving the outcomes for patients with confirmed COVID-19. But we continue to look. We've seen dexamethasone and other drugs show some positive effect, and we will continue to keep open mind. But what we do have to do is to do the biggest studies we can in the most controlled way and give the best information that we can to people. And many independent agencies around the world have come to that same conclusion. And the other thing we need to be careful with is, like with all drugs or most drugs, they can have side effects. And certainly hydroxychloroquine is associated with potentially significant side effects and should only ever be taken, especially in the context of COVID-19, under medical supervision. And it is still obviously the right of any physician to prescribe a drug for an indicated drug for their patient according to national laws and national guidance. But all we can say is that at this stage it does not appear that hydroxychloroquine has a benefit in the treatment of sick patients with COVID-19.
That goes to your first question that you asked about the science and the speed of the science. I mean, what Mike was describing, these are randomized controlled trials that are happening in the context of a pandemic. And it's really incredible that these high quality studies are being done and that these results are being available so quickly, because we can answer questions. This one may not have the positive outcome that we would hope for, but still, I mean, the science is happening incredibly fast. And it's just an example of the speed at which these results are coming out.
Yeah, this was a great one. I'll take another question from our viewer, I think on Facebook. How long a COVID patient remain contagious? Any difference between mild, moderate patients and severe critical patients in terms of duration of transmission?
That's a fantastic question, and it's a fantastic question. So yes, we are. This is an area of active research, because we know that people can test positive for COVID-19 using these molecular tests, PCR tests, for quite a long period of time. But that doesn't necessarily mean that they're infectious, that they can transmit the virus to others. From the data that we have seen, there is a difference between mild patients and severe patients. The data is very limited right now. We're working with a number of labs who are testing patients systematically, so regularly testing patients over time, which will allow us to not only see if they're PCR positive, but if they can actually grow virus, which means there's viable virus to transmit to others. What we know so far is from mild patients, there are 3 or 4 studies that have shown that someone can transmit the virus to others for up to 8 days, maybe 9 days, but they don't identify live virus after 9 days or so. There is a difference between severe patients. There's one study, it's in a preprint, and the lab shared these results with us through one of our international networks and teleconferences, actually 2. saying that someone who's more ill, someone who's really severe, we can find live virus from them up to 3 weeks. But those individuals are in hospital and they're isolated. So there is a difference between mild and severe patients, but we're using this information to help us understand how long someone needs to be isolated for contact purposes, to prevent passing it to others. But it's really important that part of this package that we recommend to countries, which we have from the beginning, is that all cases are isolated. We would like cases to be isolated in a medical facility or a special facility so that they don't have the opportunity to pass to others. There are situations where people who are mild, who don't have underlying risk factors, who are under 60 years old, who can be cared for at home if they're infected. But again, if the virus is in the home, then we have to make sure that they don't pass it to other people. So it's really, really important that all cases are identified, even asymptomatic cases, because they can also pass the virus to others.
Thank you very much, Maria. Here is the next question coming from LinkedIn. How will I know that I'm COVID negative after I was positive?
You mean after?
Do patients repeat their tests, or
so
how do they confirm they are
that's
negative?
also a very, very good question. So it's linked to the first question that I just answered.
The question's coming.
Yeah, keep them going. You're challenging us, and this is, these are some of the most critical questions right now, because all of these recommendations. I will answer the question, but all of these recommendations that we make have implications on how countries manage this. They have implications for where patients are treated, where they are isolated, and they all have not only a health impact but an economic impact as well. In terms of when someone is negative, in the beginning of this pandemic, we recommended repeated testing, and if somebody had to test negative twice, and they had to have 2 negative tests at least 24 hours apart. What we've recently done is use the data that I just described to give other recommendations that are not testing based, to say when someone can be released and is no longer infectious. So what we recommend now is for symptomatic patients, they have to have at least 10 days, they need to be isolated for at least 10 days from the time that they develop symptoms, plus an additional 3 days after symptoms resolve. If you are asymptomatic, it's 10 days from the time you test positive. We have guidance on this, and we have a visual that's coming out, but it does link back to when someone is infectious. But again, we're still learning. We're still learning a lot about this virus. As new data becomes available, we will incorporate that into our guidance.
Thank you very much, Maria. A few of our viewers on Facebook are asking, is it possible to infect it again with COVID-19 once you already suffered it or not?
Another very good question. So what we expect is, and what we are seeing, is that people who are infected with the SARS-CoV-2 virus, this is the virus that causes COVID-19, they develop a response, an antibody response, which is something that naturally happens after any infection. What we're trying to understand is what this antibody response means in terms of immunity, in terms of protecting them against another infection, how strong that antibody response is, and for how long it lasts. We don't have a full picture of this yet. We do expect that people will have some protection for some time, but again, we don't know how long that will last.
Thank you, Maria. Here's the next question.
We have one for Dr. Mike Ryan here.
There is one, Dr.
Oh, this is good. Keep going. You're on a roll, right?
A Facebook viewer says by name, Dr. Ryan.
There we go.
I am concerned about the concept of herd immunity. Some people believe it is better option. What are your thoughts on this?
Herd immunity is a term that's generally reserved for people who work on vaccination, and because we want to try and understand when we're designing or developing vaccines what proportion of the population do we have to vaccinate in order to stop the disease moving. You don't need to vaccinate everybody, and in that sense I think everyone gets that. If we're sitting in a room and I'm in the middle of the room and everyone around me is vaccinated, then I'm in some senses protected by a wall of people. And if the next person who has the disease is far away from me, then it's going to take a lot for that disease to move towards me. And that's the concept of herd immunity. What proportion of the population do you need to vaccinate in order for that effect? And that's what's called the herd immunity effect. It means, in a sense, that you don't have to be perfect in your vaccination campaign in order to achieve disease control. You get an advantage. And for different diseases, that's at different percentages. So in general, for viral diseases, it's probably somewhere between 60, 70, 80%. For measles, it's higher because it's very infectious. It spreads very easily, and you need a much higher number of people. So herd immunity is essentially the number of people in the population who are immune to the disease. And that's usually achieved by vaccination. This has been somewhat taken into the COVID world, where without the vaccine, people say, well, the number of people who are positive in the community is 5 or 10%. How many people need to be positive in order for us to reach herd immunity? Well, it's a debate. We don't know what that number is. Most scientists will agree that it's somewhere between 60 and 80%. Others would think that it could be lower. And I won't go into the the epidemiologic and mathematical details of it, but there are certainly arguments that it could be a little lower. But whatever that number is, we're nowhere close to it, which means this virus has a long way to burn in our communities before we ever reach that. So the idea that we would have herd immunity as an objective, in some senses, it goes against controlling the disease, because if you were to say, well, we need to have a herd immunity of 70% and we should let the virus spread until we get 70%, we've seen what happens. Hospitals get overwhelmed, a lot of people die. And again, what we don't realize or we don't understand fully yet, and I think it's something we need to understand a lot better, and I say this to younger people online, there is this perception, and it's true, that the vast majority of younger people have a milder version of this disease. But we've seen significant long-term impacts. Yes, they don't die, but we don't fully understand the long-term impacts of this disease. And anyone who's looked at patients who are severe with COVID realize that this is a very severe multi-organ disease that stresses many systems in the body, the cardiovascular system, the neurologic system. And we will have to assume that in milder cases, that similar process may be happening at a milder level. And we don't know what the long-term impacts of that are going to be on people's long-term health. We've seen perfectly healthy young people go to hospital, have a moderate disease, and then come out and find 10, 15 weeks later, they still can't run, they can't exercise, they're out of breath, they're getting coughing fits. Who wants or needs that? So I think we really have to come to grips with, yes, COVID mightn't kill me, but COVID could debilitate you for a significant period of time. And therefore we have to take it seriously. We have to take protecting ourselves and protecting others seriously. I said it, I think, last week. At some level we have the right to potentially risk harm to ourselves. We have no right to risk harm to others. And I think we need to look at that very, very carefully as well.
Thank you, Mike, very much. You mentioned now that COVID may prevent some people or disable some people to go gym and do some sports for some time. We are receiving a lot of questions from several viewers across platforms about going to gym at the moment. Is it safe to go to gyms and exercise? Some countries are reopening gyms. So what is your opinion on that?
I think it's very similar to the arguments that have come up around opening schools or opening other venues. When people mix, as Maria has said, the virus likes people. You put people together in closed environment, particularly where they engage in strenuous activity that may involve them producing droplets, heavy breathing, shouting, whatever else. And in that sense, gyms and have been shown in this outbreak to be associated with higher levels of transmission. But, and I say but, because if there's no disease in the community, then the gym is safe. So everything about these environments like gyms or bars or nightclubs or anything else, the risk of those environments depends entirely on what is the risk in the community at large. And if you've worked together, and if the community have worked together with the government
All right, there is that live discussion taking place. WHO Director Dr. Mike Ryan and Dr. Van Kerkhove, who are taking questions. I see that they're very busy on social media platform Twitter answering questions. So certainly you can ask your questions directly to them as they deal with them this afternoon. Thank you very much for joining us here on